Welcome, everyone. We're so glad to have you here. I'm Dr. Robyn Pashby.
And I'm Dr. Kelly Donahue.
And we are here with a group of panelists that we'll introduce in just a moment to talk about what it's really like. So this is a second installment of our panel discussion using for people who are using GLP or GIP medications. And we'll get into a little more details, but very quickly, this video is being recorded, but we are trying to protect participant privacy. So there'll be no video. There'll also be no chat during the panel discussion. The chat will be only to Dr. Donahue or myself in the Q&A time. We will stop recording before the Q&A, and it will be done only during the chat. So no one should be able to see you or hear you during this talk. And then the last thing before we get started is that this is meant for informational purposes only. We're not giving medical advice. And even though we are both licensed clinical health psychologists, we are not conducting therapy or acting as therapists in this. And we can certainly provide you with resources following the talk if you're interested. And we really did create this space to be supportive and educational. It is not a forum for debate, judgment, or criticism of a choice that a person makes about his, her, or their weight or health. And so we trust that you will abide by that. And then, so a big thank you to our three panelists. We have Melissa at the top there. We have Deborah in the middle, and we have Stephanie down at the bottom, and they are all going to share their experiences with us through a series of Q&As. And we're so grateful to all of you for being here. So thank you.
Great. So we are going to get started with some of the most common questions that we hear from our clients, and we're going to hear from any of the panelists who want to answer. So the first question is, how and why did you decide to try the medication? Who wants to jump in first?
Deborah. Yeah.
Basically, it was based on my numbers. My A1C went way up when I had to return to the office in September, which I was not happy about having to do. And commuting was stressful, and my A1C just shot up higher to the highest it had ever been. And I knew that I had to do something other than what I had been doing, which was being on just metformin, and clearly it wasn't working. I found it really hard to control my eating. I wasn't exercising, and and I had basically put off for several years. My doctors kept on trying to get me to use an injectable, and I just refused for reasons that I'll go into some of the other questions.
Thank you. Yeah. How about others?
I think for me, I'm a really logic-driven person, and I took a really scientific approach to it. I asked the question, can I decrease my body fat with diet and exercise alone? And I did lots of research. I read peer-reviewed studies. I talked to my doctors. I talked to dietitians. I talked to my therapist. And I constructed a hypothesis that said, you know, I don't think I can do it, despite what the common wisdom is that, oh, you know what, if you eat fewer calories than your body needs to maintain its functions, if you eat less than you're expending, you'll lose weight. I thought I knew that, but I wanted to prove it. So I went on a controlled diet for a month. I ordered one of those meal plans. I did Sakara for a month. I ate exclusively Sakara, so I knew exactly what I was putting in my mouth. I exercised, and knowing exactly how many calories, exactly how many macros I was eating, the math said I should have lost 15 pounds, and I lost 0.6 pounds. Something didn't add up. The math wasn't right. And because the math didn't add up, I knew that diet and exercise weren't my panacea. Yeah. And that was the point at which I was willing to try something new. And I went to an obesity medicine specialist, and I tried injectables, and it was the right decision for me.
Melissa,
I'll
how
say
about you?
I had a similar, but not exactly the same experience as Stephanie, because of other medical conditions that I have. So I have Hashimoto's and PCOS, and saw a new endocrinologist, and they brought up the idea of injectables for me, basically because everything I was doing in terms of eating well, exercising, and taking care of myself wasn't working to lose weight. And in fact, doing things like cardio and, I bought a Peloton during the pandemic, thinking I could continue my exercise regime. That was actually contributing to the weight gain because of how my biology works. So injectables were presented to me as an option to combat some of like the secondary condition issues that I was having. And I thought it was a really interesting perspective, and figured why not try it and stop struggling with something that I can't control on my own.
Yeah.
Moving on to question 2. How has medication impacted your health behaviors and mental health, like movement, exercise, sleep, cravings, food that you're currently eating, mood, and anything else?
It's a big question.
That's a big
So
question.
in a succinct answer, Melissa, let's start with you, just since you were just sort of finishing up. What's it been like for you?
Yeah, it's been pretty liberating, actually. I feel like I've been able to be less restrictive with myself and less concerned about things like counting calories or dealing with, like, am I eating the right things? And I just kind of like go with what my body tells me. Like the other day I was craving red meat. So like my boyfriend and I went out and got a burger, and like it felt great. And it's not something I eat all the time, but it's something that I wouldn't have necessarily allowed myself to do years ago. I have another friend who's on injectables as well, and we joke about how we only crave canned foods. So for some reason, potatoes seem to be really up there, and not something I ever ate before, but something I want all the time now. But yeah, overall, I would just say like it's like really opened up my world of eating. Not that I wasn't eating before, like I love food, but it just has kind of like allowed me to, free myself up to trying new things, eating things that I wouldn't eat normally before. And then I do also like think about the nutritious aspect of it, so making sure I'm still getting a balanced diet. I'm not eating those things all the time, but I'm allowing myself to do so when I want to.
I agree completely with that. It's freeing, and I think it's because my brain is giving me the signals of satiety. It's telling me when I'm hungry, and I'm allowing myself for the first time and having the opportunity to trust myself and feel that's what it feels like to be done. And I remember the first couple of days of starting the injectables, I would start eating something and I'd put the fork in my mouth and I'd get this feeling. I didn't even know what satiety felt like. And all I knew is my brain was telling me to put the fork down. And you hear people say, put down the fork. My brain was telling me, put down the fork mid-bite. And I was learning to listen to that. And for the first time in my life, I am not counting macros. I am not counting calories. The only thing I'm doing is ensuring that I'm getting enough protein in, because that's something that's important to my body for feeling good and functioning. But I am eating intuitively because I can trust my intuition. My intuition is telling me, eat your vegetables, eat your protein, eat your fruits, prioritize those things. It's not telling me, go eat a bag of Doritos, go eat 3 cupcakes. It's not telling me to binge. It's those, sure, I mean, sometimes a cookie will sound good, but it's a cookie. And then I move on, and it's so freeing. It's amazing.
Deborah, would you start us off with question 3, just because of our time? I'm curious to hear your responses to any challenges you faced.
It's ranged from some family and friends being curious and I think interested in like, wow, you're doing that for yourself, and how's it working, and how's it, how are you feeling, to my sister, who's always been the one criticizing my, you've just got to exercise and have self, control and discipline. And we all know that that does not help, especially when it's a close family member telling you all that, who has never had a weight problem. But even, as she's seen, and I've been on it now 3.5 months, or maybe I'm on my 4th month, and I've gone up to the second highest dose on Mounjaro. No, the second lowest dose on Mounjaro. And the weight has been coming off. And so now my sister is like, oh, wow, this is working for you. And it's always been a struggle before. And then I have been I have discovered that a couple people at the office are either on Mounjaro or Wegovy, and one of them shared with me yesterday she just could not come in, and we were supposed to have a meeting in person, so she did it remotely. And so she told me, and she had, I think, she maybe just started, and I was like, it does get better.
So some side effects.
Yeah, and I think you have a question about side effects. Yeah.
We do actually. Next, maybe will you guys share a little bit about what side effects you've experienced?
I mean, I am still having, I'd say, a lot of upper GI distress. Incredible. I could win a burping contest right now. And it's, it's like, oh my God, this is awful. And just, really feeling uncomfortable. But it's not all the time. And I've also had some lower GI distress. My sleep has been somewhat affected, not in a good way, keeping me awake, but it's not having a harder time falling asleep. And I take medication to help me sleep and stay sleeping through the night. And I've noticed that food tastes differently. Like all of a sudden, like coffee and I love my coffee, does not taste good anymore, the same.
What about other folks? Do you have other similar side effects?
I had some similar side effects. I think like towards the beginning, and especially when changing doses. So I'm on Wegovy, and I definitely experienced a lot of really bad side effects when I was taking too high of a dose. I almost felt like I was pregnant and had morning sickness. And ironically, I had a friend who was pregnant, and we had the same cravings and the same timing with our morning sickness. So that was fun. That was a fun journey together. But since the medication shortage has ended, and since I've been able to kind of like stabilize the dosing, I haven't really had any side effects. Even on the shot day, I don't really feel any different. I would say like when it was really bad or like more noticeable, it was usually not the day that I had the shot, but either the next day or the 3rd day into that week's medication, that it was really bad. And my endocrinologist who prescribes it also has a nutritionist on staff who I saw monthly at the beginning when I started taking it. So it was good. I had that support as well. She gave me a lot of tips. She, explained like, you might want to stop eating X amount of time before going to bed, and like avoid food before or after a certain amount of time when you wake up. So that sort of stuff really helped me. And since kind of stabilizing the medication, I haven't really had any issues.
Stephanie, how about you? Anything?
very similar. I'm coming up on, I think 20 months on Ozempic and Wegovy, depending on what my insurance company is covering at the time. I mean, it's the same medication, just delivered differently. I would say it's been like low-level morning sickness. A lot of the time, not severe. I had one really nasty episode going from one dose to a higher dose. It was nothing that a bag or two of IV fluids and some Zofran didn't kind of fix. But I think that's one of the reasons why it's so important to make sure you're with a good doctor with these medications who can help you manage side effects and manage dosing.
100%. 100%.
Mm-hmm. And so it could be that some of these side effects you had been prepared for. Some of them may have been surprising. Was there anything else that has surprised you about using this medication? The medication itself, your reaction to it, people's reactions?
I would say that I think two things. One, I put off for years trying an injectable because the whole idea of injecting myself just freaked me out at first. And it reminded me of my grandmother, who was insulin dependent, injecting herself. And, you know, with just taking a pill, I was able to kind of say, oh, I think I was in denial that I really did have diabetes, you know, and I wasn't controlling it very well. And I had such cravings, especially sweet cravings and carb cravings. And so when I finally opened the box this time, which I never got to before, and saw how easy it was, that it was all the syringe, the needle was all self-enclosed. I didn't have to touch it. And it was just pushing a button. At how easy it was, I was like, oh my gosh, you know, what was I afraid of? And I think the other thing is that I was surprised that for the first time in my life, I didn't feel the cravings. I literally have been eating probably like half of what I ate before, at least half. And I don't usually feel hungry. In fact, in the beginning, I had to force myself to eat, which that's a problem, I think, because I think you obviously have to get into healthy eating habits. And I'm definitely still not there enough.
Yeah. Thank you. Stephanie, please share.
Yeah. You know, I'm looking at the screen now, and it looks so negative. I mean, it's not as negative as it looks. So sitting with your emotions can suck. And I'm saying that because a lot of times I would, like many people, I would dull my emotions with food, whether it was excitement, happiness, sadness, anger, everything. You could kind of take the edge off of anything, or for me, speaking for myself, I was able to take the edge off of anything with food. It didn't even have to be a binge. It could have just been like, you know, I had a really hard day. I'm going to just eat something that's going to make me feel good in the moment. Now that's off the table. Not because I can't, but my body just can't. It just doesn't want to. That's not what my body's telling me. So there's no substitute for that. Sure, I can go for a run. I can get on the Peloton. I can do a yoga class. I can take a bath. I can get a manicure. No, I have not yet found a substitute that takes the edge off. I'm sure insert substance here, but nothing does what food does. And I'm learning now at age 40 to sit with my emotions and to learn from them. And I can't believe I'm doing that at this point in my life. So that's something I did not expect.
Yes.
I'm gonna just like piggyback on that. I'm really glad that Stephanie said all of that, because I have experienced the same thing, like especially more recently. So I've been on Wegovy. I actually just check. I started August 2021. So a little bit longer, I think, than everyone else here, but yeah, emotions suck. And like, there's, I don't have the same like way to curb it as I did before, but at the same time, I do feel like a lot freer. I feel like a lot of the mental space that was taken up by food and eating and weight fixation is gone now, and I can focus on other things in life, and I can live a much fuller life. And like, yes, food does play a role in that, but it's a different role, I think, now. But yeah, there are times when I'm just like, oh, I wish I could just like go treat myself and have something to not take the edge off, but like just something to like get my mind off of whatever's going on. And you don't have that anymore. So you kind of have to like relearn certain skills that you would never think of with weight loss and food.
That's right.
Absolutely. Okay, and so what do you wish you had known, if there's anything, prior to starting medication?
I guess I'll start with this just because I mentioned how long I've been on it. When I first went on it, my endocrinologist said you'll be on it full dose for about a year, and then there's like about a year on either side to titrate up and down. That doesn't feel like it's the case. I've talked to Robyn about this before. She's like, I don't think that's true. But I think there's a lot of like ability to shift between how much I'm taking and what it means to be on it long term versus if I go fully off of it. And I don't know what the plan is right now. We're just kind of like seeing where things go. Especially now that I feel really stable on the dose that I'm on and I've hit a comfortable weight. But I do wish that they were a little bit more forthcoming with the fact that like there probably is a very high chance that I'll be on it in some way, shape, or form long term. But we don't know what the future holds with other medications and other options. So that may not be the case. But I think I've come around to it a lot more than I was in the beginning, where I thought it was like a 2-year treatment plan and then I'd be done.
Yeah, I think that to piggyback on that, I don't know. I mean, everything I've read is that, you know, you may be on this forever, but I don't think that the answer, you know, that they know definitively yet, because especially, you know, Mounjaro, I guess, is the newest one that was more recently approved. I wish that my doctor did not really give me any information about the injectable. She prescribed it and said, try it. I've had good experiences with my patients who are on it. So I would have liked more information rather than just having to do my own reading on it and know what to be prepared for more. And I mean, I had heard about stomach upsets, but I wasn't quite sure what that meant. And I think there is a need, there's definitely a need, and you know, to have some either help with your nutrition and that some of the physical feelings that you're having are normal.
Mhm.
You know, when your stomach starts going kind of crazy.
Thank you, Deborah. That's why we're doing these things, actually, to try to help educate people ahead of time. So thank you for participating for this reason. Yeah. Stephanie, I feel like your answer is a great way to sort of wrap it up before we get to the opening for Q&A.
Yeah, I will say that I could have never imagined that I would be where I am right now 2 years ago. I didn't believe that a medication could give me a sense of satiety. I didn't believe that a medication could give me freedom around food and the ability to trust myself and to feel like I didn't have to be controlled by thoughts about food. So I want like people who are on this call who are listening to know there is hope. And if the first medication you take or the first dose you take doesn't work for you, there are 10 other options out there. And it's not necessarily one of the ones you've heard about. So just because something doesn't work for you, there is something else that will.
Mm-hmm. We could not have said it better ourselves, and we don't want to. Before we go to the Q&A, just a quick reminder that next month in June, we're doing, someone in here met, when we talked about the family and friends, they talked about a bit of a slow warm up for some people. So next month's topic is I love you, but I just don't get it. So it's an opportunity for family or loved ones or friends or support people to come and listen to more education around what these medications are, how they might help people. And then in July, Kelly and I are going to do a mindset shifts and behavior change, sort of like a crash course in CBT for people who are using these AOMs. To try to help support the health and behavior change journey that people are on alongside them. So with that, we will open it to any questions in the chat for people. So